During our stay in Belize, we performed many public health activities such as health fairs and mobile unit visits to different villages in the district, but the experience that most affected my global health awareness were the home visits we made. Most of these patients' health statuses were so severe they were unable to bring themselves to the clinic for treatment or medications. It was during these visits that I was taken out of my comfort zone and put in an environment in which I was not familiar with that allowed me to grow as a professional. I knew that we were doing a lot of good for the people of Belize, even if it was just for a short amount of time. Being aware of the fact that the Mayan women did not like to be touched or stared at caused me to approach these women differently than I would have in a health setting in the US. I had to be sensitive to their beliefs of shamans and ancestral rituals. Reading about cultures in a book and actually having the chance to enter the homes of several individuals of different backgrounds, such as Mayan, Creole, and Garifunas, allowed me to encounter and learn these differences on a first-hand level.
Babylons are watching over you,
Through my experience in Belize, from what I have read concerning both the geography and patient population of the country, I have come to understand that this is a medically underserved population. An underserved population is a group of people in a rural or urban area where there is not adequate access to modern technologies or healthcare facilities and services. This poses many logistical issues with the provision of care to the people. While culture and dialect differ, health concerns of this population parallel the health concerns and needs of any medically underserved population. They experience the same major disease processes as patients here in the U.S. I feel strongly that as a medical professional, aside from the duty of continuing your education, you also have a duty to utilize your skills to help the people who need it most. The education and knowledge I have gained thus far as a student has given me the power to be a force for good within my community and beyond. Nurses are supposed to be patient advocates, educators, caregivers, communicators, and managers. I take these responsibilities to heart and am committed to act in all of these roles. By having the opportunity to work with people in an underserved area, I gained invaluable experience, which will help me to better serve my patients and my community upon entrance into my career as a registered nurse.
Public health in Belize is different than it is in the US because of their extreme lack of resources. With the District of Toledo having the highest poverty rate, it is difficult even for healthcare workers to get a hold of necessary items. In the US, we are fortunate enough to have a reliable means of transportation, whereas in Belize, the bus runs only on certain days and never on time, making it difficult for individuals to reach healthcare before it is too late. Similar to the US, public health clinics are set up in accessible areas in each community, and education for the public is vital. Cultural competence is essential when attempting to deliver important information to any individual. An example would be the stigma attached to having lice or scabies in the Mayan culture. As professionals, it was important for us to teach about the commonality and how easy it was to be transmitted from person to person. We had to stress the importance of treatment for everyone in an entire village in order to gain their compliance. Another form of sensitivity that a local phlebotomist shared with me was during all the blood draws he made without the use of gloves. The last patient was a sick 4-year-old girl, and after drawing her blood, he explained that she had HIV, but it was important for him not to treat her any differently.
Not just a culturally sensitive, but also a culturally competent nurse is crucial to being an effective patient educator. By learning about a patient's cultural background and cultural practices, you learn how to better communicate both verbally and non-verbally. You learn what gestures and what phrases they use, what is polite and what is considered to be rude. This is very important in building a relationship of mutual respect and trust with the patient and their family. Patients may have varying healthcare practices. as well, such as the use of alternative therapies and herbal remedies. If a trusting relationship is established, then the patient and their family are more likely to share information on their personal healthcare practices. This in turn allows the nurse to create a safer plan of care that is meaningful to the patient in that it incorporates their cultural practices.
My perspective on life and my career has changed since this trip to Belize. I learned and felt things I never even thought about in the past. After meeting Celia, the only nurse for Hillside Clinic, I was blown away by the public health work she had dedicated herself to. Being paid almost nothing, her motivation to stay and work is simply because she gained the trust of her patients and wanted to keep the relationships with them intact. She described the ethical dilemmas she faces on a daily basis, such as deciding which patient should be tested for further treatment. Celia has demonstrated the true definition of what a nurse is by being able to connect with the community on a humanistic level. Going back to the basics and truly caring for people are the same values she instilled in me, in which I too decided to be a nurse in the first place.
When I met my beautiful woman, she promised to love me. I remember the day when I met my
The experience abroad taught me many lessons that I will take with me as I enter my career as a nurse. I learned to slow down and really take the time to get to know the patient, their family, and their culture. Without all of the machines, labs, and high-tech diagnostic equipment we have here in the United States, I had the opportunity to revisit and strengthen my assessment skills utilizing therapeutic communication, observation, and critical thinking. What do you do for a patient who has type 2 diabetes, who cannot monitor blood sugars at home, who may not be able to afford fruits and vegetables and other healthy choices, who has no gym to attend, and whose lab results are difficult, if not impossible, to obtain? Being in Belize really helped me to think outside of the box and to meet my patients at their level of understanding and treat them utilizing the resources available and accessible to them. Medications, labs, and procedures are limited, which forces you to critically examine your plan of care and how each specific intervention will impact the outcome of the patient. If a patient who is 92 years old and is suspected of having colon cancer undergoes a colonoscopy, for example, will those results alter the plan of care? The patients in the southern part of Belize we were working with, for the most part, did not have access to the life-prolonging and life-sustaining treatments we have at our disposal here in the United States. Being in this environment offered me an opportunity to really understand the importance of a good assessment, building a trusting relationship with patients and their families, and the use of therapeutic communication.
It's a dedication to all them lovers. Love the one you love. She's the one you love. He's the one you love. Remind each other day and night where you come from, how you met, the way you met. Lovers rock.